So, Maureen, thanks so much for being on the show.
Thanks for having me. Really
I,
excited to be here.
yeah, can we just start with like what you do and, your interest in sexual health, how that, where that came from?
Okay. So I'm a nurse practitioner, and my specialty is sexual health. So people ask me this a lot, like, how did you ever end up in this field? So it's an interesting story. So I worked in a women's clinic for 10 years, so doing OBGYN. And so that's where you think people would go if they're having sexual concerns.
Or at least you think that's where they could go, right?
Right, right.
Yeah.
Or the primary would refer them. Oh, see, talk to your GYN about that.
Yeah.
So that was us. And so I know my patients were struggling with intimacy and sexual concerns, but I didn't ask questions because I didn't know what to say. I
Uh,
didn't have experience, I didn't have the knowledge. So they weren't getting the help they needed. And I don't think many of my colleagues were doing it either.
mhm.
So I recognize that that's a problem, that's a real need. So in 2010, I went to the Florida Sex Institute and got certification in sex therapy. And so I started my practice in 2011, and I didn't really care for the approach that I was shown about, like, pathologizing people, because that didn't seem right to me,
Okay.
because people are different. So then I became a health and wellness coach, because that model seems to me to work much better. It's collaborative. It's helping people identify what's important to them, what are the barriers, what are the challenges, and how do you get where you want to be.
Okay. So
So I've
the,
been doing this since 2011.
so the pathologizing one is more the nurse practitioner approach or the sex therapy? What training
Well,
see you
it's
to pathologize people?
um so where I was trained to be a sex therapist, there was like kind of that white coat, put on the white coat, and let's talk about your dysfunction.
Ah,
Um, and that just didn't sit right with me.
yeah.
And I also felt like, as a nurse practitioner, I needed a lot of tools in my toolbox, because everybody's different. Um, and if I'm going to help people, I have to have a lot of different ways to help them get where they want to be.
Yeah. So these days, as a health and wellness coach, then what are the kinds of cases? I guess you don't call them cases anymore. What are the kinds of people that come to you? What kind of problems are they presenting with? What's the variety of stuff you're working with in terms of sexual health?
Okay. So mostly I'm working as a nurse practitioner.
Okay,
I put on my health and wellness coach hat when I'm working with people out of state or in different parts of the world.
gotcha.
So I see people with low desire, a lot of women with low desire, a lot of men with sexual performance anxiety, erectile dysfunction. And so that's, anorgasmia, arousal concerns, painful sex is very common.
Yeah.
And I also see a lot of young men with ED, and that's a whole other subject. So I don't want to go there.
Yeah. Okay. Yeah. I was going to go down there, but we'll leave that for now.
Yeah, yeah.
Um, so, I mean, maybe you alluded to this and why it was hard for you dealing with patients back in the day at the women's health clinic, but why do you think healthcare providers aren't usually asking about sex and sexual health?
I think a lot of them felt the way I did. They didn't feel like they were knowledgeable. They didn't have the experience. They didn't know what to say. And it's true that nurses, physicians, healthcare providers in general get very little training in sexual health. And so that's why these questions aren't being asked, because I don't want to ask the questions if I don't know the answers.
Right, right. You don't want to open up something and be like, oh, never mind. I don't know how to help you.
Right.
Yeah. That's kind
But
of
you can always help.
right. It does seem sort of astounding that I mean, I think we do think gynecologists, urologists, I mean, don't they know about sex? But there's still not even a lot of sexual health training for them.
There isn't, because I work, with a big group, and yeah, they're great GYNs, great surgeons. They know a lot about the body, but as far as like talking about something that's so vulnerable related to sex, it's tough for people.
Yeah,
The majority of people have good intentions. They want to.
right.
I work with a lot of healthcare providers. This is really my passion, educating healthcare providers to address these issues, because they want to, and you just need some skills, and it's not. You can do a lot with a little.
Okay. And why would you say it is so important for them to bring it up? to ask these questions, right? And not just
because
wait,
it,
I guess, for the client to bring it up.
yeah, because they usually won't, because it affects the quality of people's life. It affects relationships, and relationships affect families and communities. Um, and people want to connect. People want to feel like, they're seen, they're valued, they're loved, they're desired, all of these things. And it really, a lot of it comes down to intimacy. And when people are concerned about, sexual function, they'll stop doing that. They'll stop touching, and people are sleeping in the same bed and feeling so lonely.
That was one of the things that a really early client said to me that has stuck with me 15 years later. Like I would never feel lonelier than when I'm in bed with my wife. And it was just,
Yes,
it was, it
exactly.
still breaks my heart. And I know he's not the only one. Yeah.
Right. Oh, he certainly isn't.
Yeah.
It's very common, and it doesn't have to be like that. So, if sexual health, if healthcare providers would ask these questions, you can do a lot of anticipatory guidance and to help prevent things and problems from occurring like that, and loneliness and breakup of relationships, and it's very important. And so many of these things can be prevented
Yeah.
or stopped from exploding into something much bigger than they ever had to be.
Right. Because there could also be referrals to sex therapists or whatever else too, or PTs, pelvic floor PT or whatever.
Right.
Be
And just
helpful.
simple
Yeah.
strategies like use lubricants, use moisturizers. Erectile dysfunction is very common because there's anxiety. How do you,
Yeah.
minimize that, or how do you reduce the anxiety and get in your body instead of your head? And these things can be taught, and it's not that hard.
Yeah. This is what you're saying. You can do a little. I mean, you can do a lot with just a little, right? It's not like people have to go back and
Exactly.
get a whole other master's degree or something like that.
No, no. And it just listening to somebody and validating their feelings is healing.
Yeah.
And as healthcare providers, we do know a lot of things that can help, um, but we just have to make time for it and ask questions. That's another problem.
Yeah.
With very, very limited time in an appointment, you may have 7 minutes, and you've got so many. You've got to go through a whole history and address their problems, and it doesn't come up, and because there isn't the time. But patients can always say, I have something that I'm concerned about. It's very important to me. Can we set up an appointment so we have time to talk about that? So set up a follow-up appointment.
Okay. Because it does seem to me that sex is probably, I mean, I don't know what the statistics would be. It would seem to me that most people going in to see a healthcare provider won't introduce this topic. Like the provider asking the questions is what gives the permission to be like, oh yeah, you care
Exactly.
about that part of my being as well, right? Like I just
Right.
have to imagine that if your healthcare provider isn't asking, a lot of people just aren't going to bring it up,
They're
right?
absolutely not going to bring it up.
Yeah,
Absolutely. And that's why
yeah,
people are suffering when it's needless.
yeah.
But people can also learn from people like you. Well, I do have these concerns. How do I address this with my healthcare provider? What can I do? What can I say? How do I open the dialogue?
Yeah.
Um,
So talk about that a little bit, because if your doctor is not asking you these questions, how
mhm.
can you advocate for this? How do you recommend that people do bring this up, and what can they say?
Well, first of all, validate that it is important to you. Start there.
Yeah.
And so your provider there is to help you to address concerns, any health concerns. So going in and saying, I have some concerns. I've noticed that I have less libido, or I'm not getting aroused like I used to, or I'm experiencing pain. And this is really important to me. This is an important part of my relationship. So I'm very concerned about it. So I'd like to talk about that with you because you're so helpful to me in so many other areas.
Yeah.
Right. And lighten it up. Right. But also write down your questions, because you'll get in there and you'll forget. Don't
Mhm.
wait to the last minute to when they're walking out the door to ask the questions. So when they come in, how are you doing overall? We'll bring it up then.
Yeah, lead with it, right?
Yes.
Yeah. I mean,
Yes.
I imagine part of what else is going on for people, because I see this with my own clients, is when something isn't working, they really feel broken. I mean, there can be such shame and such like, this is just broken. There's nothing I can do about it. It takes a certain amount of resilience or something to go to somebody, ask for help, and even have the possibility that maybe there's something we can do about this. It's not just me.
A lot of people, yeah, a lot of people think there isn't anything. So like, with aging, when estrogen drops, they think, well, that's just life and there's nothing to do about it. I just have to accept it. That's not true at all. That I hear over and over and over again. So
I do
just
too.
this morning, yep. And this is typical. You probably hear it all the time. Something's wrong with me. A woman will say, heterosexual couple. I never think about sex. I could go months without having sex. I used to think about sex. I used to like having sex. It's really causing a problem in my relationship. My husband has higher desire. I have low desire. He feels rejected. So she thinks something's wrong with her because she doesn't have that spontaneous desire. That's what
Right.
she's describing.
Right.
So I asked her the questions. Do you get aroused? Yes. Do you experience pleasure? Yes. Do you have an orgasm? Yes. Most of the time. Do you have any pain? No. You are perfectly normal. You have responsive desire. You've got little kids. You've got a full-time job. If you expect to just feel that spontaneous desire, it's not likely to happen.
Well, and this
Maybe
is
if you're on vacation.
another reason why, and I know you're doing this work, and thank goodness, that it's so important for providers to lead with these questions, because somebody who is just feeling broken is less likely to seek help. They just think, I've lost it now. So
right. And that's why, healthcare providers can talk about this. I mean, you can talk about responsive desire, in 3 minutes when you're talking to somebody, and that can really change the course of their life.
Yeah.
So I wish all healthcare providers really understood that, because a lot of people don't. I didn't know it before. I didn't know the difference between spontaneous and responsive desire. And so just with pieces of information like that, you've got something to offer, and you can open the dialogue.
Yeah.
As a provider.
So what do you recommend to people where they actually try to talk to their healthcare provider and they kind of get dismissed? Like I've definitely heard this from clients. They've gone to their doctor, they've had pain with sex, and the person says, well, just have a glass of wine.
I knew you were going to say that.
Right. Or it's all in your head, or whatever it is. Like sometimes you make the effort to put yourself out there, talk to your physician or whatever. And you don't get what you need there.
Right.
What should people do?
And that's dismissive. And that's, I hear it. I just heard it 2 days ago.
Yeah.
From someone who said that, have a glass of wine. And that's just an example of the provider doesn't know what to say.
Yeah.
It's ridiculous. Have a glass of wine. I mean, sexual desire is multifactorial. There's so many facets of it. So, she knows, it doesn't seem right. That's how you're going to respond to it. So it's dismissive. It can make people feel ashamed for even bringing it up.
Right.
So rather than saying, have a glass of wine, say, you know what? I get it. It's very common. And unfortunately, I'm not the expert in this area, but I know who is. So I'm going to give you the name of this person. She's awesome. And she's the one to talk to. I think she can really help you.
Yeah. And for the patient who's heard this from their doctor, I mean, personally, I would say go talk to somebody else. Don't give up and take that as the last word, right? Like keep seeking help until you get somebody who's really listening to you.
Right. And this is where I feel like in every clinic, in every office, there should be one person, a lot of people, but let's just say at least one go-to person to address the sexual health issues. So just when I was a nurse, there was, we couldn't get IVs in, there was one nurse who could get it in anything. Throw it across the room, she could get that IV in. So we would ask her for help, just like with sexual health, because there's people who are really embarrassed, like providers who are very embarrassed talking about sexual health, they can't even say vulva. And so that they're just going to shame the patient more.
Yeah.
So say, you know what? I think it would be really helpful if we set you up with an appointment with, Susie, whatever.
Right.
And so in every office, there should be one go-to person. And this is what I feel very passionate about. And this is my mission in life, is to educate providers so that they have somebody, every clinic, every office. We've got a go-to person. So then they don't have to feel like, oh, I'm leaving the practice. And then there's oh, why are you leaving? All of those things. But also everybody should have a referral system. They should know when their community is available and send them in the right direction.
Yeah. Yeah. And again, I think if you've been the person that's heard, just have a glass of wine, start asking your friend, get recommendations, get referrals to other people, try, keep reaching out. Don't give up. The book, When Sex Hurts, it still strikes me. He starts off that book. They start off the book that most women need to see 6 or 7 different medical providers before they get an accurate diagnosis about what's going on with the pain. So it's like it can take some real perseverance on the part of the patient to like keep going and to get somebody who's taking you seriously.
Yeah. Instead of just accepting, well, this is the way it's going to be.
Right.
Well, that's where everybody should know the pelvic floor physical therapists in town, because they are the most awesome.
Yeah.
They are so helpful, and they really can help people,
Yeah.
manage these challenges.
Yeah. So
Yeah.
besides having, one person in each office that really is well versed in sexual health and having the referral list, what else do you wish all healthcare providers kind of knew or had in their toolkit to help with
I, I
sexual
wish
health?
I wish they all would really understand the value of this in people's lives. And so that they would come back to the basics about just like creating a safe environment to talk about this. Even just like 3 or 4 minutes can be validating to people.
Yeah.
So, that the empathy, watch the body language. If you recoil, if they ask that question, they're gonna shut right down. So active listening, asking questions, and not, having a computer in between the two of you, like dictating, or writing your note. So like really facing on body language, all of that, knowing basic things just about sexual arousal, things like erectile dysfunction. Well, most common cause of erectile dysfunction, that I see is anxiety.
Yeah.
But also, I think most healthcare providers know this, like when ED shows up, well, you've got to look for a cause. It can occur 3 to 5 years before the onset of cardiovascular disease. So it's like the canary in the coal mine, things like that. But just as far as sexuality, another thing, when I did mention, I see a lot of young men with ED in their teens and 20s. And so I wish that pediatricians, especially, were educating young people about the risks that can be involved with excessive viewing of pornography. And I think it needs to be in the middle school, just when they teach about drugs and alcohol and seatbelt use, all of these safety things. They should talk about, that this is what we're seeing. The effect of excessive amounts of porn can affect sexual function. These healthy people, young men, are experiencing ED and they're horrified. And I have so many people who say, I wish I would have known this. If I knew this, I wouldn't have watched so much. And then that leads to isolation and, feeling broken and depression, and nobody's talking about it.
Yeah.
And I know you know that a lot of people will argue, well, no, porn doesn't cause ED. Well, I'm just telling you my experience, and there is a lot of literature that does support that it may affect it. And I'm seeing a lot of people who actually is causing a great deal of distress, and they do get their sexual function back when they.
I think the one thing I would add to the list, which maybe is unrealistic, but as a sex therapist, we had to do a training called sexual attitude reassessment, which is basically right, finding your edges, what's outside of your comfort zone and why, and understanding, how your own limiting beliefs show up or your own judgments. And, that was so important. And it just seems like medical providers should have that same kind of thing. So they're not bringing in their own shame or their own conservative upbringing or stereotypes or whatever it is into the room in a way that could be harmful to patients.
That sex isn't important to people over 50.
Yeah, I was going to say that too, right? Keep asking about
or
sex.
70 or 80.
Yeah.
And educating people that you can have a great sex life into your 80s. It's not going to look like it did in your 30s, most likely,
right?
But it can be very satisfying.
Yeah. Yeah.
It becomes more global.
Anything I forgot to ask you or something else come into mind that you want to make sure to share?
Well, again, I said that I really, I think we're really doing a disservice to people by not asking about sexual health issues. Like even something like people go through cancer treatment. They're not given the information that they need, or they're not hearing it. It may be presented to them. But I really think that they need to understand what you can do to prevent some of these problems from occurring, because it's a lot easier to prevent something than try to reverse something once it's happened.
Yeah.
So I feel very passionate about getting this information out. And people say, well, there's nobody in the community, but there are people out there like me and like you that are available and, can see people anywhere. And, but I want to really educate the healthcare providers, because if I educate them, they go out and they
Right,
address it, and
exactly.
it's
You get to
addressed in
have
the clinic.
exactly. You get to have a much bigger impact if you can impact a profession.
Right.
Yeah. So where do people find you if they want to reach out, if they want to work with you? Like where should they go?
So my website is drmaureenryan.com. So it's DRMAUREN Ryan.com. You can find me there. I have an Instagram, drmaureenryan.com. My website or my Facebook is that. Then I have another Instagram too. Menopause does matter.
I love it.
Yeah, it's
Great.
important. It does matter.
Yes, it does. It does. Thank you so much.
Thank you. I appreciate you having me here.